This episode's brought to you by Heidi. Imagine kicking back while a HIPAA-compliant AI scribe juggles your notes, ICD-10 codes, letters, billing, and all that jazz for free. Yeah, you heard us right. On the house, it's free. From the genius brain of Dr. Tom, who hated wasting his life writing notes, he started Heidi to change the game. Your Heidi transforms consult babble into crisp, clear soap notes, personalizing itself with every edit you make. It's the next best thing to cloning yourself without the weird science behind it. One day, your Heidi will look through research, take calls, and do anything you don't want to. So what's the catch? There's no catch. If you currently pay for an AI scribe in your practice, you should swap to Heidi. They'll even credit you for anything you've already paid. Heidi will save you an hour or more a day without dipping into your wallet. Dive into the description for the link and make your practice the envy of every stethoscope in town. Sign up, lean back, and watch Heidi work its magic. All for free because you've got better things to do.
We work hard as physicians to take care of the health and well-being of our patients. But when it comes to our money, do we have the same condition of care? Probably not. Let's change that together. Welcome to the Financial Freedom for Physicians podcast, where we'll fight and advocate for your financial literacy. As always, I'm your host, Dr. Christopher Liu. Thanks for being here. Let's jump into the show. Hey guys, welcome to this week's podcast episode where I interview entrepreneurs, people doing things on the cutting edge, changing lives and making impact. And today I'm happy to welcome Lee Cordell, and she's a trauma and nervous system regulation expert. And I love guests talking about burnout, resiliency, how to activate your parasympathetic, how to regulate your nervous system, how to heal your nervous system, which is a really interesting neurodiversity. And I'm happy to welcome Lee to the show. Welcome, Lee.
Thanks for having me.
I know this topic is really interesting to me because it's just really interesting when you talk about healing your nervous system. You never think of it in that term. So talk about your background, your story, how you got started, and we'll delve right into the conversation.
Sure. So I founded the Institute for Trauma and Psychological Safety back in September of 2021. And that was after leaving my healthcare career as an acute care nurse practitioner and graduate level professor in December of 2020. So about 10 months after the pandemic. And, one thing I saw through all of my childhood experiences and then also through my professional experiences was just the impact of how our nervous system and how regulated or dysregulated we feel has on our relationships with ourselves and with other people and with the world around us. And so during my doctoral program, I actually had an experience where I still don't know how this happened, but I somehow ended up in a brand new nursing orientation lecture, and it was on trauma-informed care. And I had been a nurse nurse practitioner for several years at that point. And I remember walking out of it going, oh my gosh, why are we not just shouting this from the rooftops for all of our humans? Because this would make such a difference in how we're doing things. So that's really what the Institute was birthed out of, was that personal experience of experiencing burnout and just the dysregulation of the healthcare system in general as a provider, and then also personally as a mom and a wife and as a human.
Yeah. Like I said, it brings up so many, I still have PTSD from residency training, and I was, and it's just like, isn't there like a better way to like train doctors and without, it seems like such an inefficient way and unhealthy way of I actually have worked with several physicians one-on-one, and I have to say, like, being a nurse practitioner was tough. And I watched many of my friends go through medical school and residency, and I was like, I mean,
the you are dysregulated more than you're regulated with that education and training program for sure. It's a lot.
Yeah. Yeah. And it's almost like, you, the, you have to sacrifice your health, your family, your kids, your relationships, just for this kind of, position,
Mhm.
which is not really secure and safe these days. So, um,
Yeah.
yeah, I love this idea. What you talk about is, so one thing you talk about is this, idea of, when you talk about this, healing the nervous system. And one thing
Yeah.
that's really been on my mind is, how do you know you are healed? That's,
Mhm.
and you have all these techniques, breathing. How do you know you're healed?
You know, that's such a great question. And I think it's a continuum. Anybody who actually tells me like I'm healed, I'm good. I'm like, okay, like I'll see you in a couple months.
Yeah.
you know, I don't I think it's if we look at it more as a journey than a destination, that's really helpful. For me, what I found is that the littlest moments have had the most impact of, oh, wow, that used to be a place that I used to get so upset or I used to get so triggered. And now that thing can happen and my body doesn't have this threat response. Um, I can stay regulated. I can stay open-minded. I can stay curious. So, whether it's an email from your boss saying, hey, we need to talk, or it's your, partner rolling your eyes at you when you walk in the door late again, or it's whatever, these moments where it's like, this used to feel scary, or this used to feel like amplifying, dysregulating in me, and now they're not.
Uh-huh.
The more of those we string together, like that's where you're like, oh, this journey is actually starting to not feel like there's a tiger that's going to pop out at me any and every minute. I'm actually staying relatively resilient and flexible, and not just from this place of like, oh, I can just keep bouncing back, but like, oh, something hard happens and I take a minute and I process it and I like feel it. And then I decide what I want it to mean. And then I move forward. So I don't know that anyone ever reaches that destination of like, okay, yep, like I'm never going to respond negatively or I'm never going to feel scared again. And in fact, I, you know, I probably a lot of us learned about the humans in who are born without that sense of fear or without that sense of pain. They're the ones who are actually in the most danger because they can't tell when something bad is about to happen to them to hurt them. So we
Uh-huh.
still want that, but it's that balance of I'm only responding to threats when they're real and actual threats.
Mhm. Yeah. Yeah. I love that. It really helped me elucidate is like when you enter in situations or experiences that previously really triggered you, and then
Mhm.
now you can like kind of either you don't get affected, or it's, you can handle yourself through
Yeah.
these. That's really enlightening for the audience. Um, the other question is, I'm really interested in talking about these micro traumas, especially,
Mhm.
talk about what micro trauma is and its
Yeah.
impact on the nervous system.
Sure. So micro traumas, if we think about trauma, I when I go places and talk to healthcare providers about this, and I'll ask them, what do you think trauma is? A lot of times they're the most common group to say like, oh, a car accident or, getting hit with something.
Mhm.
And we call those sledgehammers in our world. Like those are the events that you're like, yes, those would be serious and significant for anybody who went through them, even if they had like all the resilient skills and they were super regulated, they would still be hard. Micro traumas are what we refer to as paper cuts. So these are the things that if you get a paper cut, like let's say I hand you a piece of paper and you get that cut, and you may notice it later in the day, like when you put hand sanitizer on or something like that, but it's not going to shift your view of me or your view of paper or your view of the world. It's going to just, you're like, oh, that just happened. However, if you and I met every morning at 9 a.m. for the next year, and every morning I handed you a piece of paper and I gave you a paper cut in the same place, after a while, that's going to shift. Number one, that's not going to just feel like a normal paper cut. That's going to get infected. It's going to be bad. the second thing is it's going to shift how you think about me. You're going to be like, why does Lee keep giving me paper cuts? Like, why is she so aggressively handing me paper? Or you might shift about you, like, why do I keep taking this paper from her, even though I know it's going to hurt? Or it might shift your view about paper. You might be like, oh my gosh, I'm never touching paper again because it's dangerous. Those little things really add up. They have a cumulative effect in our nervous system. And so particularly in, the hospital, I'm just thinking about how many experiences I had where it was little things. It was like, oh, I don't want to call that person because I know that they're going to give me a hard time when I ask for this. Or, oh gosh, like I don't want to go to that meeting because I know that it's going to be really stressful because these two people are going to not get along and put me in the middle. If you're experiencing that all day, every day, we talked about a minute ago, you asked about knowing that you're reacting, like you're not reacting when things are like not threatening.
Yeah.
What I see more, particularly in my high level, highly educated, like very successful physicians, I see invalidation of those micro traumas because we make it part of the societal conditioning. And so you're getting paper cuts all day, every day, and those add up. And you're also being told, well, it's just a paper cut. You're fine. Or you should expect to get that paper cut here. It's part of how we do things.
Yeah. Yeah. And it's quite interesting, which brings me to this, because this whole area of DEI and initiative, especially, I'm minority and, underrepresented and, pretty much this, I think a lot of these micro traumas contribute to this feeling of being an outsider and this imposter syndrome. So how can, as an organization, how can, the leaders understanding of trauma, micro traumas, and how can they lead this organization into success, on a equitable level? Talk about, your thoughts on that.
So can I tell a story to show this? Okay, great. All right. So when I was in my doctoral program, I was shadowing the interim chief nursing officer. And so I ended up in a meeting of like all of the C's, right? The CFO, the CMO, everybody. And I felt I was like, I'm a very little fish at this table.
Yeah.
And so I'm like, I'm just going to be quiet. I'm not going to say anything. And about a week before that, we had a nurse attacked in a parking structure by a patient or a patient's family member and luckily she was okay. But it showed a bunch of holes kind of in the system of where things weren't safe. And so one of the people at the table said, well, we should just have all of the managers, or we should tell all of the nursing staff and all of the support staff to go to their managers if they feel unsafe at work. And I must have not kept my poker face because my preceptor saw my face and she said, do you have something to add? And I was like, absolutely not. I'm not, I work here. Like, I don't want to endanger my job. And the CFO said, no, please share. And I said, I personally was kicked in the stomach by a patient while I was pregnant. And I told my manager that I wanted a new assignment and they told me that I was being difficult. So I said, we're going to have to, if you want your staff to share with you and be open with you and let you know when they see problems, it has to be safe for them to do so. And right now we don't have a culture where if you just say, well, just if you see something, say something.
Yeah.
And as a minority as well, it was, okay, well, it's been made very clear for me that if I see something or experience something and say something, y'all aren't going to be okay with this. So I say all that because the first piece of inclusion is really ensuring that you're creating psychological safety for the people that you are leading. And that involves trust. That involves making sure that you not only have cognitive trust, where the people you're leading can tell that you're capable and that you're consistent. It also involves affective trust, which is, do you care about me? And are you honest with me? And that do you care about me one is the one that I think we turn off in healthcare a lot because it's hard to stay open and connected when you're taking care of really sick people, when you have so much stress. So that of, I'm going to actually I'm going to show that I care about you. I'm going to actually have a personal relationship with you. This isn't going to just be transactional. That's a huge piece of inclusivity. You've got to make it safe for people to speak up and feel comfortable saying, hey, you just said this. And in my culture, like, that's a really, like, we don't, that's not, like, that patient's not going to take that well, or that employee is not going to take that well, because this is what it means over here.
Mm-hmm. Mm. Yeah, I love this. I love this psychological safety and just racial, gender equity and inclusion. Yeah, I think, like in healthcare organizations, I think that's really interesting how they're going to evolve and change. So kind of talk about healing techniques and, how do you, what are some ways to, understand how this stress and trauma is affecting your nervous system, how to flourish or how to manage that? What are your thoughts?
So I think that we get to look at it proactively and retroactively, because retroactively, if you've been in corporate entrepreneurship, academia, healthcare for however long, there's been a lot of micro traumas and probably some bigger, there's been paper cuts and sledgehammers that have happened. And so having a safe place to really process through those things is important. And I think that's the place that most people are like, oh, okay, so I need to go to therapy, or I need to, go heal my trauma. I need to go dig into my closets and under my bed and find this, What we've found through research is that's actually not a great place to start if you are still in the environment that you're going to be processing. So, for example, with police officers or military professionals, we don't go back and process your past trauma around what has happened to you if you're still actively serving, because that can cause problems.
Yeah.
So what I would say the bigger piece is going to be more preventative and in the moment. So when something happens now where there is a reaction, or you're noticing that you're feeling dysregulated, so that's you're either amped up or you're shut down. I think that's the easiest way to think about it. You're hyperactive or you're checked out, numbed out, dissociated.
Yeah.
If you notice those, the goal is to either, if you're really jacked up, to slow down. And that can be by one of my favorite exercises that my clients actually have a very hard time with is I'm like, you're going to sit and you're going to put your feet on the floor and you're going to stare at a wall for 5 minutes with no stimuli. Just look at the wall. And they're like, that is the hardest thing that I've ever done.
Yeah.
So can you just slow down? If you're noticing that you're checking out, numbing out, dissociating, then we want to gently speed you up. So that's super slow exercise, super slow breathing. One of the techniques, it's hard, you can't see it, but I'll just have my clients keep their head still and just have them move their eyes all the way towards the peripheral on the left and all the way towards the right, and then up and then down. And then I'll have them slowly move their neck. And what's interesting is they'll say oh, okay, I thought I was here with you, but in reality, my brain was over there, or my brain was just running. And so by focusing on my eyes, I'm coming back into space. So there's so many exercises. To give you context, when we teach this, it's a 6-hour thing of all the ways you can do this. But for some people, it's exercise. For some people, it's breathing. For some people, it's petting their dog. For some people, it's snuggling with their kids. There can be a lot of different ways to regulate. So if you know of one that feels good in the short term and helps and doesn't hurt in the long term, that's a really great thing to use.
Oh, interesting. Yeah. which, there was these techniques are really interesting. The other, I think, I lost my train of thought because I was going to ask a follow-up, but one question is this, this idea of, when you're triggered, this is the thing, because you mentioned the environments and, but like, for example, like when these desensitization techniques where you basically, like, if you're afraid of snakes, you kind of, but when you're triggered in, like, for example, just like PTSD, do you recommend like this kind of desensitization techniques, or talk about, how you're getting from those?
I don't love desensitization techniques. Here's why. I think that they are useful in a specific subset of humans.
Yeah.
And I don't believe it is the kindest, most compassionate thing to remove someone's self-protective mechanism before you know why it got put there in the first place. So, for example, if I had a client who struggled with driving in heavy traffic, and they were like, well, I just need to go out there and like muscle through and go through heavy traffic. I said, this is likely providing re-traumatization. Okay. Because the entire time you are dysregulated, you're out there. So anything where you're a 6 out of 10 or above from a dysregulation standpoint, you're not healing, you're causing more harm. So when we started talking, I said, look, this could be a situational trauma, or this could actually have nothing to do with the driving in heavy traffic. Something I hear from people, and I had this, I worked through this personally, was a fear of being out of control. So flying, driving in heavy traffic in the middle lane, your spouse driving, right, while you're sitting in the passenger seat. I see a lot of people get extremely dysregulated and have panic and anxiety around that because they have a fear of being out of control because when they were younger, something happened. One of the most common medical things that we see as kids is when they are immobilized for shots or for a surgical procedure and they go down fighting.
Yeah.
I've had people 30 years later, when we get into like reprocessing, that's why they can't get on a plane. That's why that's why they can't have their back to other people in a restaurant, because they have to be aware of their surroundings and know if someone's coming at them, and they have to be able to get out. So to bring that back around to the desensitization, once we know that that's why that behavior, that fear is there, a lot of times we don't have to do the desensitization, because if we can regulate that person's nervous system and process that specific trauma, they're fine driving. They're fine getting on a plane. They're fine having their back to other people because it's no longer incredibly scary to their nervous system.
Yeah, I love that. How can people contact you and, follow you on your socials? And also, people want to take that next step in healing, reach out to you and work with you.
Yeah. So you can find us at institutefortrauma.com. That's where all of our things lie. We've got a resource page on there. We've got some self-study courses. We do 9-month certificate program. And I would say for anyone who is like, oh, I would really love to experience this, we actually have an event in November in Columbus, Ohio called Full Capacity. And we're going to be for 4 days actually doing these regulation techniques and learning about why they're so effective. So you can find that on our website.
I love that. And for all the audience out there, let's thank Lee for coming on and give her socials a like and follow. She's also got a podcast called Becoming Trauma Informed. Check that out. Check out her upcoming event and reach out to her for help or coaching and healing. And with that, thanks so much for coming on.
Thank you for having me.
Thanks again to Heidi. Elevate your practice with a free AI scribe, zero cost, HIPAA compliant, and ever learning. Heidi turns tedious tasks into time saved. Ready to swap? We've got you covered for past AI scribe expenses. Head to HeidiHealth.com, get started, and make your practice the envy of every stethoscope in town.
I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislewmdphd.com for more support. I'll see you next week.